Welcome, family, to the show. This is Bridging the Atlantic, brought to you by Young Boss Media. I am the host of this episode, and it's a very important episode. And so just so you know, Bridging the Atlantic is a show that was started because during Corona, all of us were sitting at home. And what I recognize is that because we're all living in the virtual world, we can talk to anybody, anywhere, at any time. And as Pan-Africanist, I said, hey, let's start actually having conversations across the Atlantic to people in the motherland, people in the Caribbean, people in UK that look like us, go through similar experiences that we actually have not only not been able to speak to, but not allowed to speak to. So this is a rebellious show. You feel me? We are actually going against the grain and have conversations with our own people all across the world. So we're bridging the Atlantic and having back to home conversations about what's going on in our community. So the first episode was about women. The second episode was about Black men. And this episode is about health. What is the state of health of Black people all around the world? So whether you want to call us Black folks, indigenous, original people, Nubian, African, melanated, whatever your terminology, however you identify, if you look like me, this show is for you, right? And so I brought together a few doctors from South Africa, Nigeria, and right here in America to have a conversation with us about, what is going on? What are you seeing with your clients? What conversations are you having? Has your research shown? We have a second wave of Corona. We have civil unrest all over the globe here in America. Right now in Nigeria, there's a lot going on. And before even this year, 2020, we've always been stressed out. Diabetes, sugar, obesity, just everything, small, climate change, living in environmentally hazardous places, and just our conditions, and racism, oppression, just the stress of just this life really seriously impacts our health. And sometimes we don't have a doctor to actually call on and say, hey, doc, what's going on? Many of us feel like we can't afford it. We don't have health insurance. We don't know who for when the conversation of politics, healthcare come up. We don't know what to do. So today's conversation, we're actually talking to real doctors, not your cousin that watched YouTube videos and think they're a doctor. Real doctors. They study. They are in the field. They are seeing people every day and really helping our community. So I want to bring onto the program. I'm going to introduce them individually. I'm going to let them speak about, one, just who they are, where they're from, their industry. And I want to know why you chose medicine. So as I bring you on and you introduce yourself, please let us know why you chose medicine out of all the things that you could do, why this field. And so I want to go down to South Africa to Dr. Salome Mswimbe, and I want her to tell us, who she is and why she chose medicine. Welcome to the show.
Thank you so much. Thank you so much. Really excited to be here. So I'm Salome Mswimbe. I'm an obstetrician and gynecologist. I'm also head of global surgery at the University of Cape Town. And I do a lot of things, which are a lot of collaborations with international universities, work with international institutions. I'm also a World Economic Forum Young Scientist. Why I chose medicine? Because I wanted to make a difference. Initially that's what it was about. I was passionate about making an important contribution to humanity. I didn't know what that looks like. I didn't know whether medicine was the right path. But the more I got into it, the more I realized that I'd chosen the right field, and through medicine, I could make a difference. And so a lot of the work I do now is research and global health related work, looking at improving outcomes across different populations, and not only seeing patients one-to-one, but looking at how can we make healthcare better, surgical care across different countries and across low and middle income countries, particularly in Africa. Thank you.
Thank you for being here. I look forward to the conversation. Now we're going to head over to Nigeria to talk to Dr. Amarachi Allison. Welcome.
Thank you. Thank you for having me. My name is Dr. Alison Amarachi. I work with International SOS. I'm a general practitioner with emergency medicine training. I chose to be a doctor because I wanted to help people. I love to help people really, and effect as much change as I can from my own end at all times. as much as I can. I was recently recognized by the MyPad, most important and most influential people of African descent, um, class of 2020, top 100 under 40, for the International Decade for African People of African Descent that was announced by the United Nations. So I work on site, and I think that's about it. Thank you.
Thank you for being here. Thank you so much. And now we're going to head over to Philly, back here in America, to Dr. Gene Wright. He is dealing with the science of mental health, and brother has a lot of information to bring us. Dr. Gene Wright, how you doing?
I'm doing well. Thank you so much for having me.
Absolutely.
And so glad to be here with my sisters and all of your audience. I know this is going to be a great conversation. My training is in clinical and forensic psychology. And I got into this field because, like your other guests, I grew up knowing that I was going to be a servant leader. That's how I was raised by my parents. And so that means helping people. And the more you help people, the more you are helped. And so my biggest interests really lie in the impact of trauma in communities of color. Specifically, I break that up into, depending on the audience I'm talking about, possibly the impact of trauma with boys and men of color. I also do some work with young ladies and women of color as well with that, because the traumas are different, even though they're having some similar experiences. And then also the issue of mass incarceration, or what people call over incarceration. That's another area of interest, again, because that impacts the people who look like me, and it impacts individuals who are in communities of color across the world, not just America. But as we know, the United States is the most prolific in incarcerating its citizens. And so all the traumas that come before you even get to a jail or a prison, add that onto the amount of young men that we have. We're only 12% of the population in the United States, and we make up 47% of the prison population. That tells you all you need to know in terms of what an epidemic is, what a pandemic is, all those things, those words we throw around. But we don't often look at that when we're talking about boys and men of color, girls and women of color, and what they're going through. So those are my interests.
Thank you so much for you all being here today. This is going to be a great conversation. So first, I just want to put it out there. We're not going to act like racism doesn't exist, income inequality doesn't exist. We all are on the same page that it exists, and that has impacted us greatly. And so I want to start the conversation with that, because once we get into Corona and civil unrest and how that impacts us, that's a whole beast of its own. I want to get into just the basic conversation of how does racism and income inequality impact our health? How have we been impacted in our communities? And Dr. Gene, I want to start with you since you kind of brought that up already.
Sure. The main thing is when you have a predisposition for certain conditions. So I'll let my physician colleagues talk about what those conditions are. But basically, when you're already bringing compromised health into the situation, then you have what we call disparities in access to healthcare. That's not just physical healthcare, that's also behavioral health. And so that could be because you are either underinsured or have no insurance. It may be because you've been identified in this current COVID pandemic as an essential employee. And essential means different things to different people. It could mean you're in the medical field and that's why you're essential, or it could mean because you're providing services and goods and stocking the shelves and making sure there's food, and that's why you're essential. Or it could be because you are in a position or a job that you cannot afford or do not have the opportunity to work remotely. And so you're always constantly in the community interacting with people. And so when you think about the disparities, you think about what your income level is, you think about what you have access to in your resources, that adds to the stress, and it adds to the challenges for Black and Brown people around the world in terms of how they can take care of themselves, how do they take care of their families, what resources do they have available, and that seems to be a common thing regardless of where you're living.
Awesome. Dr. Ms. Women, I want to ask you the same question because you had brought up this income inequality. How are you seeing it impacting your patients?
Yeah. So, I mean, a lot of my work is really about access to care and quality of care and looking also at outcomes. And so when we look at outcomes, who has the highest maternal mortality rates, who's dying at the end of the day from preventable, who's having preventable deaths? It's Africans, it's sub-Saharan Africa. I often say that, if you were to sort out some of the issues in sub-Saharan Africa, then you wouldn't, then we wouldn't even have to go to the Sustainable Development Goals, and that's how serious it is, that it's people of color who tend to have the worst outcomes and the most preventable deaths, and who die prematurely, from conditions that they shouldn't be dying from. I often say, we talk about geographical areas and saying that sometimes it's really about where you are. If you were in a different part of the world, you wouldn't have died from the condition that killed you, and so it's these conversations where, whether we want to admit it or not, there is structural racism, there are structural barriers, there is a legacy of colonization, and a lot of us, even with improved health systems, but a lot of that goes, a lot of things that went wrong continue to affect children today, future generations. So as a result, even a baby that's born today, a woman who's pregnant, a lot of, you can almost predict what their outcome will be based on where they are, what race they are, and where they come from. And I think that tells you that it's not simply about, it's not an equal world, it's not a fair world. There are serious equity issues, and they are geographical, they are racial, there's class issues, there's gender issues.
Can you give me maybe some numbers of like just comparing, a rural community versus a well-to-do community in South Africa? Like, what are the comparisons?
Yeah, so I mean, and every country obviously has got a different system. In South Africa, we've got two systems. We've got a public and private healthcare system, and so 20% of South Africans can afford private care. The rest afford public healthcare, and so which is offered to them for free. But when you start comparing where the majority of preventable deaths happen, they happen in the public health system, where there's a lack of resources, where there's a shortage of doctors, there's a shortage of specialists, in district hospitals, in smaller hospitals where they don't have specialist care. So in my field, where we look at cesarean sections, for example, we looked at cesarean sections across Africa. We found that African women were 50 times more likely to die from cesarean section complications than women in other parts of the world. So it's disparities across continents, it's disparities across class, like I've mentioned. So even in some parts of South Africa, women, if you can afford private care, you're not as nervous about going to have a cesarean section as someone who might be going into a public health care system where they know that they've got relatives and friends who might have had complications from cesarean sections. And as a result, a patient might refuse to have a cesarean section when they need to have it for life-saving reasons, because they remember that my cousin, my sister, my friend died from this complicated operation. And by the time they have it, because it's a life-saving operation, a lot, they're more vulnerable to more complications because they would have, not gone through the correct steps to get the treatment that they require.
Definitely there's trust issues with Black people about everything. We don't trust anybody for right reasons. We've been conned, we've been tricked, we've been stolen, kidnapped, raped, pillaged, murdered, hung, lynched, all that. So there's definitely mistrust of the medical system, because I don't know too many Black doctors here in America. When my own personal doctor here in New York is a white guy. And so I don't like that. And so it's like, I'm always trying to search for the Black doctor, the doctor that I can have a conversation with, the doctor that can relate to me and can understand me. And so you are very far and few in between, at least in my experience here in America. So the mistrust is real and it's high. Dr. Amarachi, can you answer the same question? How do you feel, or how have you seen income inequality impact your area in Nigeria and the clients that you deal with? Patient that you deal with too?
I mean, it's just like Dr. Salome said, we operate a private and public healthcare system here in Nigeria, and majority of the people here can't afford the private healthcare system, so they have to go to the public hospitals. And then in the public hospitals, we have the problem of uh, we're short-staffed. There aren't enough doctors. I mean, with going by the WHO standard of the physician to patient ratio, it puts we here in Nigeria puts us to about 4 to 10,000, 4 physicians to 10,000 patients. And the NME, that's the Nigerian Medical Association, says that we have about 40,000 doctors in Nigeria, a population of about 196 million people. And to top that, a lot of doctors are migrating to Canada, to the UK, leaving Nigeria. So that's even puts a lot more stretch on the already stretched healthcare system here. And then there has to do with that. So a lot of doctors, healthcare workers in general, find that they are overworked. And then there's also the problem of infrastructure, infrastructure, and uh, when you talk about uh, making budget for the healthcare sector and having facilities available on ground, emergency medical services, and so we don't have a lot of that. And here in Nigeria, we do mostly a lot of um, clinical diagnosis and all of that. So, but in the light of with the COVID pandemic, with the ongoing COVID pandemic, a lot of people had to step up. Private sectors, we saw sectors stepping up to bridge the gap to fill the space in between. So there were the people that the people that had to provide blood banks, the people that provided transport, the people that provided communication to link these services. And ideally, these are things that should be on ground. Now, these people that have, I mean, the people, the higher socioeconomic class, have access to these things. They have access to the internet, they have access to internet activated phones, so they can use these apps. But more than 50% of the population is in abject poverty. So they don't even have access to these things. A lot of people are still not even aware of electricity, light, and all of that. So, so it's really, really, really impacts our health care system here.
Thank you. And so, Dr. Amarachi, so you were actually the first person to detect the coronavirus in Nigeria, correct?
Yes, correct.
That's your claim to fame. Like, we've got to take that now. It's one of them.
Yes, I am.
You are. See, we got it's a panel of celebrities, you know. So we have to celebrate you all.
Thank you.
Absolutely. And so right now in Nigeria, I mean around the world, we're dealing with a pandemic, but also right now in Nigeria, we're also dealing with civil unrest. Can you talk to us about what's going on in Nigeria really quick? Not really quick, but we also want to get into the bigger picture of just Black people being stressed out completely. So can you give us just a brief understanding of what's happening in Nigeria right now?
Okay, so right now, there's been an ongoing protest about police brutality and ending SAS, a section of the police, a part of the police. And although the protests have stopped for now, after the protests stopped, because of the recent the Lekki Tollgate massacre, where a lot of people were killed, shot at, and protesters died. And there's been an unrest about where a lot of thugs and hoodlums attacked and burned down buildings, looted properties, and all of that. So because of that, there's been a curfew that has been impacted across different states in Nigeria. And in the light of that, some uh, some warehouses, COVID-19 palliative warehouses were found, and then hungry people have been trying to get, these were the palliatives that were supposed to be given out during the peak of the pandemic here in Nigeria, but somehow they weren't kept and distributed to the people. So a lot of people have been breaking into these warehouses and raiding them, taking food, rice, and all of that. So and of course, when there's a crowd, things tend to get out of control. So it has escalated to the point where buildings have been burned down, lives have been lost. There's been clashes between some people, killings, shootings, raiding. So because of that, everybody's on high alert. Everywhere is tense, and curfews have been impacted, and nobody is really moving around now. So we are all on high alert.
I understand completely. Dr. Jean, so this goes into your area, this little bit of, it's madness. It's madness what we've been experiencing for centuries, right? Just all around the world. And so in these different areas, we saw it after George Floyd, we're seeing it in Nigeria. And I mean, we've been seeing it across the world. But I guess we haven't had like the phones out, like we do now, right? But it's been going on. And it's madness. And so there was one doctor. So there was supposed to be a few more people on this panel, but just, it's crazy right now, right? Mental health issues. I even, sometimes I have to take a break. I can't always sit on panels because it's just too much. I have to take time for myself. What is the state of mental health of Black people right now? Just with everything going on top of everything else that's been going on, and what do we do? How do we take care of ourselves? This is a mess.
Yes, I mean, you put a lot out there, and as well you should, because there's a lot going on. And so kind of piggybacking on the last question you had, I can tell you that in the United States of America, at 12% of the population African American, there's approximately 2.5% physicians. So there's a reason why you're having a difficult time finding a physician of color, because there's very few. So that really taps into it. And so when you're not, when you don't have access to people who look like you, who understand to some degree at least what your experiences may be, that mistrust that you talked about is heightened even more when you're in a situation where law enforcement are misusing their powers. And of course that, based on what Dr. Emera said, that's across the world. It's, police is not, police brutality is not just in America, but in terms of the control, the fear, the high alert that Dr. Salome talked about and Dr. Emera talked about and that we're talking about, that has always been the case for African Americans in America. And so when you see the knee on George Floyd's neck across America and across the world, people saw themselves with the knee on their neck. I have two sons. I saw myself with the knee on my neck. I saw my boys on the ground with the knee on their neck. And so across the United States, in the world, when you see that scene, it's not that it wasn't happening before. Of course, you're right, Monica. It was happening before. But when you have it on tape, when you watch a person take their last breath on television, on the news, and it's played over and over and over and over again, news feeds constantly over and over again. And then you read about or hear about Breonna Taylor and you read about, vigilantes in Georgia, who took out, Ahmaud Arbery. When you read about those things, but now we have technology, we can see it. We are a part of it. So you have the micro and macro aggressions that are perpetrated against people of color. It's nothing new for an African American. It just happens to me, walking to a store, in a department store, and the the plainclothes security is following you around the store as if you're going to steal something, standing in line and not being served or being ignored. Those are the things. But now it's it's gone to the level of taking people's lives. And so the mental health, the stress, the anxiety, the impact of trauma, what I can tell you is that trauma follows you through your lifespan. So if it's not resolved, you will continue to experience it. Had a woman a few years ago tell me, I was sexually assaulted when I was 10 years old. And I've never told anybody, except I'm telling you, doctor. And she said, now I'm 75. She carried that for 65 years. Unresolved trauma follows you through your lifespan. What does that mean for us? It means from the time that we are born as African Americans in America, we may experience trauma. And then if we are not able to get support and help for it, then it will continue to fester and it will continue to impact how we are. It will impact how we think. If you look at the Kaiser Permanente data on the ACEs, adverse childhood experiences, you'll see that for African Americans, and you can look this up in Philadelphia, we have a pediatrician, Dr. Roy Wade, who replicated the Kaiser Permanente study in Philadelphia children. Why? Because Philadelphia, of the top 10 largest cities in America, has the highest level of poverty. And so he replicated that study to find that in African American children, those ACEs, those adverse childhood experiences, are even more produced or higher than in the general population. And so the mental health, the challenge of not being okay and not knowing what to do. You already hit on it, Monica, in terms of the disparity in access to healthcare. And so there's a disparity of you don't have enough of providers in your zip code. And then there's a disparity of they may be there, but I don't trust them. So I'm not going, you know? And so you put all that together, it's that high alert that the two doctors talked about before. Walking around every day, tense, anxious, depressed, not having enough resources to care for your family, not knowing what to do, being in a target and being profiled by law enforcement. To be, anytime you're pulled over, anytime you're walking down the street, you could be pulled over up against the wall. You know, where are you going? Who are you? You know, why are you in this neighborhood? That is a constant challenge for boys and men of color in America. And then in terms of what do you do about it? That was the last question. The thing that we have to do is what we're doing now. Even though I'm so glad, Monica, that you're exercising self-care and taking a break from time to time, we need you on that wall. We need you on that wall. You know, the old reference of Nehemiah, you know, when he was rebuilding the wall in Jerusalem, you know, he had one hand on the brick and one hand on the sword, you know, because if we need you on that wall, right? And we need Dr. Salami and Dr. Amara, because we are the voices. We are the minority voices that speak to our neighborhoods, that speak to our moms, our grandmoms, our brothers, our sisters, and say, hey, we got you. We got you. This is what you need to do. The first thing we need to do is acknowledge that it's okay to not be okay. That's the first thing. You are not some, you know, out there on an island by yourself. You're the only one suffering. No, that is not true. We are all in this. And so what I would tell you is people are talking about the pandemic as if we're all in the same boat. That is not true. We are not all in the same boat. You heard from the two doctors before, all, you know, just the disparities and what's going on around the world. We're in the same storm. We're in the same storm, but we're not in the same boat. And so the different boats that we're in, we have to recognize that even within our communities of color, we're not in the same boat. The two doctors talked about the disparities in income, public health versus private health, and who can afford it. It's the same in America. You know, you don't have to go across the Atlantic to find the challenges. You can go right there in Southwest Philly. Okay, you can go into Bedford Sturt. You know, you can go to Brooklyn, right? You can go to Detroit. You don't have to. So that what we're dealing with is not the same boat. We're in different boats, same storm. And so that touching, we can't hug and kiss and touch like we used to. We can get on a Zoom call. We can call somebody up. We can talk to one another. We can say, hey, sister, how you doing? Hey, brother, what's going on? You can drop a case of water off on a porch, you know, ring the doorbell, you know, thinking about you. You know, you can make sure that our elderly are not isolated and lonely because people are afraid to visit them because they don't want to give them the virus. Right. And so all of these things are happening in our communities across the world. And so the thing to do is, one, take that break that Monica's talking about. You know, take that break. You don't have to be on the call the whole time. Get outside and walk around. The simple things that we forget to do, we know to do. Eating healthy, if you have that availability. Drinking plenty of water. Exercise doesn't mean you have to go to the gym, but you got to get out and walk around. You got to move. You got to move those limbs, right? But the most important thing is, just because we are social distancing doesn't mean we avoid social interaction. So it may not be in person, physical to physical, but we need to do what we're doing now. It doesn't have to be a Zoom call, but it has to be somewhere where we're able to reach out to those loved ones, those friends, those family members that we haven't talked to in a while, and do it consistently. Let them know you're thinking about them. Let them know that if you, hey, do you need anything? I can drop something off. We may not be able to touch. I can drop something off. Those are the kind of things that we can do that don't cost money. There's no SES, there's no social economic status connected to me calling you up and checking on you. That's the things that we can do. And then lastly, if and when we do determine that there is something more serious going on, access the resources in our physical health and our behavioral health communities. There are people here that are trained to help us. Let's utilize those resources. Go to the doctor. I know you may be worried. Go anyway. Right? Go see your mental health professional. Talk to your clergy, your faith leader, your imam. Talk to the people that are in the community that are there for you. And those are the things that I can recommend, because those are things that we were doing before the pandemic. We checked on one another. We cared about one another. We made sure nobody went hungry, that we're in our neighborhood. You know, everybody has that neighborhood house where if you get home, you can go to that house, you can get a meal, right? So we can still deliver meals, even if we can't come together. So those things that we were doing before we were separated are things that we can do with just a little more caution. That's what I would recommend.
Thank you so much for that. I want to go to you, Dr. Swimmen. Black women, we're supposed to be tough and strong, and we just do everything. We uphold everything. We take care of the family, the city, the nation, the world. We got it all on our back. How do you see this showing up, particularly like dealing with maternity, just dealing with women's issues in general? How do you see like this level of stress that we almost feel obligated to uphold the world? Like that's our duty. How do you see that showing up in healthcare when dealing with women?
Yeah. I mean, I also want to touch on,
Sure.
just, issues around levels of trust, because I want to add on that before I answer the question, because
Yes.
as Black women in leadership, are we trusted? When I walk down the corridor in my hospital, sometimes people think I'm a student. Sometimes they think I'm a nurse. No one looks at me and says she's a professor, and I often have to be the one that explains that, oh, I'm this. And then suddenly it's like, oh, okay. Then the next question is, in their minds, trying to work out, in South Africa, terms like equity candidate are used, sort of, you got the job, you got the title because they needed to balance out the racial statistics, and so I find a lot of Black women, a lot of people like us walking around with an imposter syndrome, because you get into committees, you get into organizations where you're at the top, you're occupying important spaces, but you're not trusted in that job. You question, and people working in very toxic environments. So the toxicity is from, it's across, whether you're making decisions or whether you the recipient of healthcare at the end of the day. There's a lot that we go through. But in the health system, I mean, like I said, there's gender issues as well. We see a lot of gender-based violence. We see issues around, adverse outcomes, maternal health, and questions are, it's why, is it the lack of activism that we have for our community? Is it that, women are not regarded as equal? Those questions that if we said we wanted women to survive, as we've seen, there have been diseases that have been eradicated because of the level of activism, the level of advocacy, where people were able to say that, polio has to end, things like that happen. But then you find high rates of maternal mortality, high rates of cervical cancer, high rates of diseases that are preventable, as I said. And you look at the communities that are going through these diseases, the people that are dying, the gender that is affected the most, you start to realize that these are not impossible to treat. We've got the cures, we know exactly what to do, but there needs to be a moral responsibility. There needs to be a community that says that we are going to protect our women from dying of these things. Now, I do a lot of activism, and because I use use my science, my research, to generate data and numbers. Initially, I used to, there was a lot of talk about overuse of cesarean section. But a lot of those stats came from high-income countries. In the African countries, it was different. Women needed cesarean sections. Women were dying whilst waiting for a cesarean section. Mm-hmm. But people didn't know because no one was really talking about this. So, so I'm raising this just to say that, even amongst ourselves, there's a lot that we can do when we take a stand to say we want to protect each other. We want to protect our sisters. I don't want to be the one, certifying deaths that don't need to happen just because we're in a health system that could be improved but isn't being improved.
Awesome. Thank you so much. Dr. Amarachi, so I want to ask you a similar question. The strong Black woman, the strong Black man, like how much of our need to survive is actually killing us? Like, how do you see, just our stress levels showing up in regards to high blood pressure, diabetes, poor eating habits? How are you seeing our stress show up with your patients? Oh, I think you're on mute.
From my experience.
Yes.
Hello. Okay. So from my experience, I have seen a lot of women who were okay, they were doing fine, and then they get out of school, and then there's that pressure to get married and settle down, have kids, have a home, have a career, have everything at once. So all of that pressure, you tend to see a young lady who's doing very okay, and then she gets married, she has kids, she's trying to put her career together, and then she comes to you and she looks different. She looks way older than she's supposed to look. And this is something that I don't know if it's been noticed, but I've noticed it a lot. They come to you and they don't look as good anymore. And then they have so much stress, so much stress. Oh, I haven't gotten pregnant, or um, my mates have this, or my mates have gotten this. And now, as the woman, you just find that you when you get married, there are people asking, when are you going to give birth? Mm-hmm. And then you give birth, they're saying, oh, it's not a boy child, it's a woman child, it's a girl child rather. And there's the pressure to have a boy child, even after you've had a girl child, I mean. And then when you come out from that place, you go to another group of people and you say, oh, okay, so what do you do? Aren't you a career woman? And then there's that pressure as well. So there are a lot of women, yes, and then you find a lot of women holding on to staying in abusive relationships and holding on to that, and then a lot of women dying. And then when you come on social media and interact with people, you find out that a lot of people believe that if if a woman has maybe died or suffered violence, that well, there has to be a reason for that. I mean, nothing justifies violence against a woman or anybody at all, really, because there are so many ways to arrive to an agreement or a common goal without violence. So these are the things you see. And even at that, when you try to intervene, you find that even the women will say to you, I will handle it. We're going to sort it out. We're going to settle it. Leave it. Let's protect my home. Let's protect my shame. I don't want to be shamed. You keep feeling. You find that the women feel that they have to still they have to still protect the home. They still have to prevent shame. I have to use the word shame now. They still have to. They feel that need to cover the shame of everybody. They feel the need to provide. They feel the need to support. They feel the need to nurture, or rather, they feel that responsibility to do all of these things. And this is just one person. So in the light of this, and with, with the westernization and the world becoming a global village, technology and all of that, a lot of women here in Nigeria are becoming very aware. And there's been a lot of conversations about women's rights. There's been a lot of conversations about women's health. There's been a lot of conversations about um, women's education. And there have been people that have stood up and come together to advocate for women more. So these days, there's a lot more advocacy going on for women. And we're gradually, slowly, albeit slowly, but gradually coming out of it.
Thank you. I'm gonna get to you, Dr. Jean, one second. Dr. Amarachi, I want to follow up what you said. How are these stressors? How do they show up in the actual like illness? Are there high rates of diabetes, blood pressure? How are you actually seeing it when you scan your patients?
Okay. You find, when you talk about hypertension, high blood pressure, lifestyle is also a major part, plays a major role in the development of hypertension. And then you find a lot of women, they they get married, or just plainly just being a woman and feeling that pressure. A lot of women don't rest, they don't sleep well, they have to, I would like to use the word hustle, because that's the way we say it down here. You find they are hustling, they are working 2 jobs, they are working 3 jobs, because they have to also provide. And then when it comes to you, you find out what's your BMI. The BMI is normal. How often do you eat? What are you eating? You find that because they're always busy, or they tend to forget to eat, they settle for quick meals, they eat a lot of junk food, they don't rest properly. And then subsequently, with time, they come down with hypertension. And then, and then, um, and then even when you diagnose them, compliance. Sometimes they tell you, oh, I forgot to take the medicine because I was busy. Where will I find the time to exercise? Where will I find the time to do this? I have to wake up really, really early to prep my children for school. I have to. So you find that the burden of everything is on them, and they tend to put themselves in the back seat. They don't prioritize themselves. They tend to put themselves in the back seat. So nobody's looking after them. They are looking after everybody, nobody's looking after them. So the things you're supposed to do to take care of yourself to prevent these non-communicable diseases like hypertension, they don't do that. So subsequently they tend to fall, rather come down with these illnesses. And let's also not forget that there's the familial aspect of the illnesses. So when you have a familial tendency or a genetic tendency to, that predisposes you to developing maybe hypertension or diabetes, you have to be extra careful. You have to really focus on yourself. You have to live a healthy lifestyle. I don't know if you're following me. You
I
have to
am.
live a healthy lifestyle, and these women don't prioritize themselves anymore. So
Right.
that's it. So yes, so it indirectly leads to that
Right.
also.
Right. Absolutely. Dr. Jean, you wanted to make a statement?
Yeah, I was just really what the two doctors are saying in terms of the physical ramifications of what's going to really resonate with me, because for what I do, it's that mind, body, spirit is connected, that holistic approach. And so when you're suffering physically, you're suffering mentally. And when you're suffering
Yes.
mentally, you're suffering physically. And when you're suffering mentally and physically, you're spiritually suffering. So it's that holistic thing that really hit on when the two doctors were talking.
Mm-hmm.
And so I just want to share a couple of statistics that bear that out, that connect that mind, body, spirit. And so we were talking about racism. So a recent report talked about, since the pandemic, they're thinking it could lead to 75,000 additional deaths of despair. Now that's a specific category, right? Deaths of despair from either drug and alcohol misuse and suicide due to unemployment, social isolation, and fears about the virus. That connects both mind and body and spirit all together right there. Then specific to racism, you mentioned about mental health and how it impacts us. So I just want to give you a couple of statistics to bear that out. As a result of racism associated with poverty and injustice, life expectancy at birth for Black men is 71.9 years, far below white women, which is 81.2 years.
Mm-hmm.
Black women is 78.5 years, and white men are 76.4 years. For the Black man, these statistics are mainly because Black men's higher risk of dying from several types of cancer, stroke, HIV, and homicide.
Mm-hmm.
Research indicates that for Black men, poor health and poor mental health outcomes in general are related to racism. For Black men in the US, racism is a daily experience, with about 66% Blacks report high levels of day-to-day racial discrimination. And that's what I mentioned before about it could be macro or micro. The macro is that institutional structural racism we already talked about. That micro is that day-to-day, you know, getting it from your supervisor, getting it from you, you know, on the train, you know, getting it when you walk into the grocery store, when you're in the department store. And so when you think about how the mind, the body, and the spirit are connected, we do not do well as human beings when we're fragmented, when we're broken up, when we're broken apart. And that's what the impact of trauma does to people of color. Whether you're in Nigeria, South Africa, or Brooklyn, it doesn't matter. The racism, oppression, lack of resources, you know, food insecurity, all these things that the two doctors are talking about happen in Black and brown communities the world over. And so that's that impact on the mental health that I was getting at, is that it does have a direct impact on your physical health. You know, worry, constant anxiety, not knowing what you're going to do next. And so when we look at these statistics, we can connect them directly to that mind, body, spirit connection that we all need. And when I think about health and wellness, I'm not just talking about getting a good physician report. We all want that. You know, I'm not just talking about being able to run a marathon, 26 miles. That's great. If you can run a marathon, great. But if you can't pay your bills, you're not healthy. Okay. I don't care what your physical health report says. Yes, we want that. But if you are living in an environment that your children are not safe, you're not healthy. And so that health and wellness that I want Black and brown communities to embrace involves what the two doctors are talking about, but it also involves supporting one another in a way that we can really look at how can we lift each other up beyond what the social determinants are doing to us. And those social determinants are poverty, you know, food insecurity, all the things we're talking about today. And then one last thing, for those individuals that are incarcerated, their life expectancy is actually 10 to 15 years less than what I just read to you. Mm-hmm. People who are incarcerated. And then finally, the highest percentage of women, of incarcerated people in the United States right now is women. Women are becoming a higher percentage in terms of, now they still haven't caught the men, but it's alarming to me that in the United States, girls and women are starting to be put into the prison even more than ever before. Mm-hmm. And so that is something that we should keep our eye on as we look at what's going on in the United States in terms of incarceration and locking up boys and girls of color, because they do it at an early age. That disproportionate minority confinement starts in the teen years. Wow. When people in the suburbs are being, you know, the police get them and take them home to their parents, say, hey, little Johnny, little Susie, they were caught doing such and such, you know, make sure they go to school tomorrow. That's what they do to the other kids. To our kids, they take them down to the police station. Right. Okay? Right. So there's a big difference. And then how does all of that impact how we see ourselves? How does that impact how we see ourselves? And how does that impact our self-esteem? All those things impact our mental health.
So I want to get into that. I'll come back to you. Media. We are in a world where media is everywhere, and we're constantly seeing images of ourselves in a terrible light. And that's existed since the beginning of the film industry. You know, we could look at Birth of a Nation, you know, almost 100 years ago, right? Not so much 100 years, but there's always been negative images of our people in the media. And then right now we can see Black death, Black rape, Black everything in front of us. I'm old enough to remember when TV went off. There was a time of night where there just was no TV. You had to take you behind the bed. When you woke up, the news was on. and it was what it was. Now you can see just so many graphic images, sexually graphic images, just dangerous images at 3 p.m. Kids could be coming home from school and see stuff on their phone. I want to have a conversation of how does media then add on to the extra layer of stress and low self-esteem and choices that people are making to eat, where to go shopping, how much money they should have, keeping up with the Joneses. Because this is almost like it's a physical, but it starts with the mind, and we're in a mind warp. And so I want to have that conversation. You can answer it how you wish. You can raise your hand, but I want to have a conversation on how media is impacting our health. I'll go back to you, Dr. Jean.
Okay, well, that's rich, because that's right down the alley. I'm a professor at Temple University. I've been there 9 years, and one of the things that I teach is developmental psychology. And there's several sections across the lifespan where we talk about the media. And there's two things that are important to know about the media. The first thing is television is passive. Okay, you're sitting on a couch or a chair or wherever you're sitting, and you're having information, you're being inundated with information. It's not an active experience. It's a passive experience of just having information poured into you. And you have very little control as to what that level of information is. You can have 150 channels. And to your point, Monica, you may only find something wholesome on 2 or 3 of them. So you can flip the channels if you want. To answer your question directly, that passive learning, that constantly pouring into our young brains and young minds, information that is sometimes useless and damaging to some degree, it does tell us what to eat. It tells us what to do. It puts images up that are attractive to our young people, and then pairs that with, products, and pairs it with situations. It shows young girls at a young age, this is how you need to look. This is how you need to dress. It tells young boys at an early age, this is how you carry yourself. And those messages may not be positive. Okay. And then there's the other thing that parents need to know. Regardless of what you're telling your young person, they have everything available to them right here. So you may as well tell the truth, because they have access. Unlike when I was a kid, my children have access to every bit of information I have access to, and maybe more, because they know how to use their phones a little better than I do. And so what parents need to know, what educators need to know is young people are not dumb. They're very, very smart. They have access. Tell the truth to your young people. Don't let them, I had to fight over it. This my son, I have a 15-year-old son, do we wait till he's 16 to get a phone? Well, what's that, the dark ages? We gave up at 13. Okay, here you go. Right. But making sure you schedule up that person so that they don't have so much time to be on this thing. And so what's going on with COVID? Hey, they know. What's going on with racial unrest? They know. What's going on with sexual assaults and sexual improprieties? They know. And so this is what's important for adults that are raising children or are teaching children. Make sure you have real conversations with your young people. And I'm not talking about preaching to them. I'm talking about asking questions and then shut up and listen to what they say. Because you're going to learn a lot more by listening to the young person than trying to put your template or trying to tell them what to think or how to say. So the media, they play a role in terms of if your hair is not long enough, if it's not blonde enough, if your eyes ain't blue enough, if you don't have the right clothes, if you're not in the right clique, if you don't go to the right school, if you're on and on and on and on, our young people are inundated with messages that tend to tear them down if they don't fit the image that's on that screen. And it's all about how many likes you get and how many friends you have. And I tell people all the time, I don't care if you have 895 Facebook friends, you better have one you can touch. You better have one you can count on. You better have one that you can trust. And that's, I think, where the media really impacts our mental health. And you've already heard me talk about how mental health is connected to physical health. So that's what our young people are up against. And I think we need to step in as adults to really kind of help them navigate this overload of information they have access to.
Right, because this is their world, their next generation.
Yeah.
Dr. Okay, just to add a little bit to what Dr. Jean just said, I will come from the perspective of stress. I mean, when people wake up to go, ease themselves in the night. At night when you sleep, you're supposed to have at least 6 hours of uninterrupted sleep for you to have had a restful night. Now, you stand up, you get up to go ease yourself, you pick up your phone, and the next thing you know, you're glued to your phone. So even adults have these problems. So imagine what the young adults or the children are going through. They go on the phone, they don't get to sleep. By morning, they are not as well rested as they're supposed to be. So they are not sharp in class, they are not learning like they should, or assimilating as well as they should. Then, aside from that, there's the problem of bullying, social media bullying. So internet trolls, like I have suffered that. I was trolled. I was trolled, and I know how I felt. I mean, I developed anxiety. I couldn't even look at my phone. When I hear my phone beep, I will start having palpitations. So I will be so scared to go on social media. So and in recent times, I don't have the figures, but there's been a very high spike in the rate of suicide, depression, and all the mental health issues. And with the studies have also shown that a lot of the roots of this problem too comes from the social media usage and overload of information. People feel self-image problems and things like that. So I think this is also another way media affects our health.
No, that's very true. Like we're living in just a completely different world, and it's unknown terrain. We have no clue what's happening right now because it's so new and it's so different and it's crazy. But it's not going to stop. It's actually going to increase. We have not seen the peak of media by far. Dr. Swimming, you wanted to comment?
Yeah, and I just wanted to say, like, media often gives half the story, and I like to say, for example, in Africa, a lot of our countries, it's not like you've got poverty in Africa and then wealth in other parts of, we've got wealth, we've got poverty. It's the distribution might not be the same, but we've got some of the best. I live in Cape Town. It's like really considered one of the most beautiful cities in the world. There are places that I'll go to, I'll drive down. And I've lived in Boston before. And I look at where I live and I'm like, I love this place. It's more beautiful than some parts of America that I've been to. So what I want to say is, we have a responsibility to tell our stories, to tell our beautiful stories, to shine the light on the excellent work that is being done, that we are doing, that others are doing. And we have a responsibility to change the narrative, to tell our children the beautiful stories that they're not going to find in textbooks, they're not going to hear about in their schools. We need to start doing that. And I think shows like this, that's part of that, telling our own story in the way that we know it, in a way that we can that we can celebrate it, and making sure that we're not being fed just by the bad stories and the negative pictures that are constantly portrayed, but we're part of telling our own stories in a way that we want our children, what we want our children to hear and know. Thanks.
Absolutely, and so we definitely need to tell our own stories. So I want to stick with you because you're doing women, gender, maternity activism. How can media be used to actually help to uplift your message?
I think it goes back to what I've just said about telling our own stories, because that's part of the activism. Because if I'm not talking about what's happening in Africa, somebody else will, and they might be telling the wrong story. Now, whilst we've got a lot of things that need to be fixed, but there's a lot of great things that are happening. There's a lot of advances in medicine that are happening, and I work with a lot of media people, putting out the stories that we want to tell, changing that narrative and putting it out there. So as there's science communication, for example, making sure that even the research that we're doing is going out in the way that we want it to be told. So it's not waiting to be recipients of whatever is put out there, but it's taking an active initiative to say that I'm going to tell this story and I'm going to tell the world what we are doing in my authentic and genuine way. In South Africa, I'm part of a group that hosts the South African Health Excellence Awards. And this was also an initiative to celebrate the excellence that we see and not waiting for other people to do it. And then through this initiative, we've been able to highlight some of the amazing things that people are doing, which may not have been recognized, before, or if left to chance, it wouldn't have happened. So we need to take the initiative as well, and not be on the complaining and angry side, but it's in our hands as well. Nothing stopping us from selling and telling our own stories in the way that we know them.
Absolutely. Thank you for that. Dr. Amarachi?
Last thing to add. I just have one last thing to add on the talk of media. So, like I said earlier, when I first came on, the United Nations announced the decade for recognition of people of international people of African descent, decade rather of African descent. So, like Dr. Salome said about telling our own stories, that's why that was created. So now, what this is about is it's giving us the floor, or rather, it's letting us know that we have the floor to tell our stories. That's why it's shining the light on people, the positive works of people of African descent around the globe. I don't know if I mentioned MyPad, so that is what it does. So, and now notice that during the COVID period, when in Nigeria here, we using telemedicine, we had, people were volunteering, doctors were volunteering to treat COVID patients, just volunteering the services basically. And it was mostly the doctors in diaspora, they were the most people that volunteered. And you find out that a lot of people of African descent want to connect with Africans in Africa, but they really don't know how to go about that. And this international decade was announced 5 years ago. So we have just 5 more years.
I know.
To bring forth exactly just 5 more years. So it's a way to put ourselves out there and say it as it is. Basically, just say it as it is from our own point of view.
Absolutely. Of course, and that's what we're doing. And we need more storytelling out there. Not just me, not just because like I said, we're not even at the peak of media, and so at this point, everybody can have a media platform and tell their own story. My goal with Young Boss Media is to not just produce, but also teach, other people how to do the same so that we can build an entire network all across the world, starting with Young Boss Africa. Now, I want to get into solutions because I'm a solution-oriented person. I don't want to sit and complain. If I complained with you yesterday, today has to be about the problem solving. I can't have the same conversation with you. So let's imagine that there were no money issues and we can just have access to an unlimited budget. What type of organization would you propose that we create to address some of the health disparities in our community? Take a moment to think about that. There's unlimited budget, money ain't an issue. What would you propose? Who wants to go first? Are y'all excited? Go ahead, somebody go. Dr. Ms. Winmaker, you can go.
All right. I would invest in health leadership. I believe firmly that sometimes it's not just the resources, it's how the resources are managed. It's what we do with the resources, and training leaders, healthcare leaders, doctors, etc. how to lead and how to make decisions and critical thinking, all of these. I think the solution lies a lot in investment in the human capital and trying to train people how to make better decisions and implementing things better and coming up with better strategies. Because whilst we've got a lot of, people making decisions, but our medical schools are not investing enough in teaching us and training us how to lead. And suddenly you're called a leader, but you don't know how to lead. You don't know how to use your resources. So I would particularly invest in training healthcare workers on leadership and coaching and training and that's where I'd put my money.
I love that. Is there an organization doing similar work that so I want to look it up? Is there a model that's already exists that we can look towards?
So, a lot of the American universities have got leadership programs, health leadership. I've done one with MIT, as there's, Harvard. They've got some of these, but I think particularly, talking about the African continent, there isn't enough of that going on at all. So, and as universities, I think we're starting to have that conversation, but I do think that this is something that could be done through universities in the medical schools, whilst students are still fresh and thinking about and wanting to change the world, basically. And that's the time you start introducing these things, not later when they are managers, but when they still starting off their careers and learning about these concepts.
Thank you for that. Dr. Jean.
Yes, I love that idea. And the Department of Behavioral Health in Philadelphia, we have a very strong leadership program. So you may want to look that up.
Yes.
Monica, check it out. We're doing a great job. We have 3 different tiers. I've been in several different tiers, and it prepares those individuals in that way. And I agree with Dr. Salome about the universities. I would go back even earlier, and I would start earlier, and I would spend my money first on removing the negative output of the social determinants that we have talked, that we kind of started the program with. It's hard to learn when your stomach's growling. I always tell people, the man that hasn't eaten can't hear you because his stomach's growling. When you feed a person, their hearing gets better. Okay, when you take care of them, when you meet their physiological needs, we all are familiar with it. With Maslow's hierarchy of needs. You have to have your basic physiological needs met as a human being so that I can now focus on the higher needs, right? And so we have to eradicate hunger. We have to eradicate. You said there's no budget, right? You have to eradicate hunger, right? We have babies and moms and elderly who are hungry. We need to eradicate that. And then that training program that Dr. Salome is talking about, now I can hear you. Now I can connect. And so those social determinants that start with that food, secure and stable housing, we take that for granted, folks. Yeah. Those of us on this call take that for granted, but yet we know people and we treat people who know all about insecure housing, right? So I would spend my money on eradicating those things. We have unlimited resources in this world, but yet only the top 5%, have the control of those resources. We need to spread that out so that nobody should go hungry in the world. Nobody should go hungry in America. No one should go hungry in Africa, in South America, right? We have resources to do that. That's where I would spend my money. And then I would start with those babies early on. That leadership program that Dr. Salome is talking about, that would be part of that K to 12. It would be part of that K to 12. This is what it looks like. And then you advance as you get higher up in your academic achievement. So that by the time you do get to college, by the time you do get to medical school or a graduate program or whatever, but we should also have those vocational programs because everybody's not going to college, right? And so by starting early, that K to 12, we identify and help people identify where their strengths are. Every child should know what their skill, talent, and abilities are early on. And so when I meet children that can't tell me what they're good at, they can't tell me what their talent is, that's that child I want to work with even more intensely because I need them to figure out one thing that they're proud of, one thing that they're good at, one thing that they say, oh, this is what I'm known for. And so to me, that's where I would spend my money. I would start with eradicating the social determinants that we deal with as people of color. And then I would make sure that education that Dr. Solomon mentioned, which is so needed, that leadership training starts as early in the process for that young person as I can get it.
I love that. I love that. Because all of those social determinants you speak of, health is the intersection. You know, you could be in different classes, different genders, different situations, but we all experience health. And if most people are experiencing, you know, income inequality, racism in some form, environmental issues, our health is always at stake because we can't get around health. To live is to deal with health. And so I love that. And it's very clear, you know, if you have a safe community to live in, you have good education, you believe in yourself, you're naturally going to want to protect yourself, you're going to live longer, you're going to have a happier existence, and so you're going to be healthier, you know? And it's hard to de-stress yourself when you're constantly reminded of just all of the wrong things that can be a part of life. Dr. Amarachi, I would like to bring you in on this conversation of, if you had an unlimited budget, what institution, organization, technology, innovation would you propose?
Okay, so I will invest more in technology. Like I mentioned earlier, during the peak of the COVID pandemic here in Nigeria, it was a lot of private sector set up. I will have develop, it will find, or rather invest in technology that will bridge this gap, that will bring services to the people, because there are a lot of people in the rural places that don't have access to these things. So I'm going to find a way to put something on ground that would be able to take health care or health services to these people, at least basic primary health care to these people. Take, for instance, when, I'm sorry, I have to keep bringing this up because this is what is going on right now. During this, after this Lekki Tollgate massacre, there was the need for blood. And then, yes, there was the need for blood. And it was put out there, and people came out en masse to donate blood. There was so much blood donations that the teaching hospital said their blood bank was full. They didn't need any more blood. And this was the first time in history. You go to these places and they'll tell you, oh, there's no blood. So it's things like this that I would love to, rather, I would invest in finding a way to bridge the gap, bringing, and another thing is this, a lot of people have health concerns, but they are shy or they're ashamed or they're afraid. So I would also have this technology handle that, like put out, to speak to a doctor, telemedicine basically, and have a way to deliver home tests to these people. Some people are afraid to go get morning after pill. Some people are afraid to go buy condoms. Some people are sexual health basically, both ways, both for male and females. So people are afraid, or rather shy or ashamed to go get tested. So you can just imagine where you can log on an app and then you have this test kits delivered to you. I mean, I would invest in stuff like that.
It's actually a great idea. All of you gave great ideas. So when I have closing statements, what is your message to someone watching this right now? They're your cousin, they're your auntie, your uncle, they're your family, on how they can, one, just better support their health and live a long, prosperous life. Because that's what we want. If we talk about generational wealth and really building our community, building up our people, health is at the front line of that. We cannot we can't build wealth if we're dying at 65, 70 years old, while other communities are living, 10, 20 years longer than us and able to, get more interest. We're talking about stocks and disinvestments, right? So we want to live a long life. We want to live a prosperous life. What is your last piece of just wisdom that you would give to somebody watching this right now? And I'll start with you, Dr. Nsweme.
All right. I think, we've spoken a lot about the social determinants of health, but education seems to be one key factor that, you invest in education, you get an education. It seems to be one of the things that solves a lot of problems, provided you can get a job at the end of it all, and provided and I would say really we need to think long term. Investment in education and having in your future stability also ensures that in the future you'll be able to protect yourself from certain diseases. You're able to advance your own progress in life, and rather than creating short-term solutions, let's hustle, go from this job to this job. I think we need to invest in ourselves, and the more you invest in yourselves, mental health, progress in life, success, and all of that, the more the healthier you're likely to become. So I'm talking about a long-term plan to protect your health, to preserve your health. And I think we owe it to ourselves, to our children, to make sure that let's invest in their well-being, in their future, so that they don't have to suffer from preventable diseases, but rather like people in high income countries where we say they die of old age. We want to see that in our communities, and it's in securing their futures, basically.
Thank you so much. I appreciate that, because we still, make choices, positive choices in our lives, and starting with education, just around everything is very important. So thank you for that, and thank you for being here. Dr. Jean, want to hear from you?
Yes, what I would say to my grandmother, my mama, my sister, my cousin, and my little friend down the street is it's okay to not be okay. We have resources in the community to help. Do not try to put on the strong face, the brave face. To Dr. Amara's point is, don't be afraid or ashamed to say, I need help. There are people that will get in line to help you, that we care about you. And even if you think you're isolated and you're by yourself, reach out to the resources that are available in the community. It may not be a relative. It may not be somebody at your place of work or school, whatever you, but if there's somebody out there that is interested in making sure that you have a healthy life. The other thing is that I don't want our listeners to spend a lot of time worrying about what they don't have and what they can't do. Mm-hmm. I think it's more proactive, even if you have limited resources, to focus on what you do have and what you can do. What's that in your hand? And what I mean when I say that is we sometimes underestimate our own power, our own voice, our own abilities, because we're looking at what other people have and we're not looking at what we have. I love the idea about telling your own story. I wanted to jump up and do the old woo-hoo when Dr. Solomon mentioned that, because that's what I'm trying to work with the young men that come back, and some not so young men that are coming back to the community from jails and prisons. They're getting podcasts. They're starting their own podcasts. They're learning how to use these things in a way that it's actually getting information out there. They're not waiting for Channel 29 or Channel 8 or whatever to come to them. They're making their own news. They're putting out their own information. They're telling their own stories about the community. And that's empowering. That's empowering. And then finally, let's connect all this to our health. If I'm feeling good physically, I'm feeling good mentally, and my spiritual core is strong, you know what? I don't care what my bank account says. I'm on my way. I'm going to be okay, because those three areas, mind, body, spirit, that strength internally makes you confident. And when you're confident, well, let me say it this way. When you have competence, when you feel competent in your ability to exercise your own future, then you feel confident. And those go together. Competence and confidence go together. And then you're unstoppable. I don't care about the color of your skin. I don't care about your gender. I don't care about your lifestyle. I don't care about any of those things. When you step out of the door in the morning, at night, whenever you step out of your home, you're going to be confident that I am a person of color that's got it going on. And although I may have some challenges, I got a nice little community behind me that's got my back. That's how we want our children to feel. And that's what I think we can actually make come true. It doesn't cost money to have a young person feel better about themselves. That's free.
That's so true. That's so true. Thank you so much, Dr. Jean. Thank you for being on. And I just appreciate your wisdom and the work that you're doing. Dr. Amarachi, closing words.
All right. So I would like to say, just add a little to what Dr. Jean said about not worrying about what you don't have and what you can't do, and focusing more on what you have and what you can do. So in that light, I would say, I would advise, or rather I would tell people, I want us to focus more on what we can do and making more connections, more collaborations with people, like partnering more. You feel you can do something to this extent and you want to do it to it to a further extent. So why not reach out to some other person that probably knows how to do it and connect with the person? So I would move for encouraging more connectivity, both diaspora, in Africa, wherever, because human rights is everybody's rights, really. And when your voices are united, your efforts are united, the goal is, I mean, the result is going to be mind blowing. It's going to be bigger than what you even imagine. So I would advise us to form a stronger community. That way, like Dr. Jean said, you know you have people backing you and you're not alone. So yeah.
Thank you so much for your wisdom. Thank you for being on here. Thank you for the work that you all do, Yeah, this was great, and there's so many more conversations that need to happen around health. But I think what we got to is that health is just the intersection of everything else that we experience. And so, I want to thank you all for being here and just for the work that you do. And for the audience watching, if nobody has told you today or in a long time, you are important, you are valuable to our community. And we need you to want to be healthy. We need you to want to be here for a long time. If you are an activist, the best way to be an activist is be here for a long time so we can continue to put our fist in the air and, be a thorn in the power side, and so we need to be healthy. We have to take care of our mind. I know it's stressful out here. There's just so many reasons to be depressed and to have your head low, but understand that we come from a strong people. We've been here since the beginning. This is our planet. So we have to take care of ourselves, and we have to pass that on to the next generation and the next generation. And truthfully, the realest generational wealth is generational health. So changing our habits really impacts our family, the older generation and the next generation, how we eat, how we just look at, our existence on this planet. You are important, you are valuable, you are loved. And let's just continue to be loved. And during this times of Corona, we lost a lot of people, but we have still a lot of people here and we have work to do. And with the ability of just a virtual world and media, we can tell our stories, like Dr. Laswame said, we can tell our beautiful stories. And it's important that we get the right stories out. We've seen what the powers of the minority, they're the minority powerful, have put out so many negative images of us. And it's time for us to really change the narrative. And so that's what Bridging the Atlantic is. Everybody else can have their own media platform to show their stories, and let's really change the narrative of our people. So that is my time. That is our time. Once again, thank you to all the doctors on the panel. And let's just continue to be blessed and reduce your stress, meditate, eat right, love yourself, forgive. Forgive all the people that you mad at. Forgive them. Forgive them. Go love them. Go hug some people. Just random people. Well, put your mask on. That's my time. Peace and love. And if you would like to see more, please go to youngbossmedia.com. And we will be here next month for another conversation. We're going to be talking about finances, Bridging the Atlantic, talking about money. You got to get your health right before we talk about that money. So I'll see you soon. Peace and love.